What blood work do I do when I see a new patient? I look at their thyroid. I look to see if they're on a thyroid medication or not. I take that into account. But remember, this is a negative feedback system, and it can be influenced by certain external influences. So based on any diagnostics that they have, if they've had their thyroid taken out, or if they've had a radiation for Graves' disease, or if they've had other thyroid surgeries or have a known diagnosis, obviously we're going to look at that. But here's my standard blood work. I always do a free T3, free T4, total T3, total T4, TSH. Those are my 5 standard blood works that I order. I will from time to time do a reverse T3. I always do thyroid peroxidase and thyroglobulin antibodies, TPO and TGA. And then from time to time, I'll do a TSI, thyroid stimulating immunoglobulin. I usually do that the second round based on whether or not someone has a likelihood of Graves' disease. I do not measure iodine levels. So let's break this down. Why do I do what I do? Well, first of all, first and foremost, salt is so important for people to eat. And the first recommendation I make to people, let's take iodine deficiency out of the equation. Let's take it out of the equation. A lot of people come in and they're taking 2 or 3 drops of Lugol's iodine, which is fine. I have no problem with that. But why not just get it as in one of your condiments? So what I ask people to do is to get a standard iodized salt, make sure it's dextran-free, a standard iodized salt, and I actually mix 50-50. I mix my iodized salt with Redmond real salt. I love Redmond real salt. And I mix the two, and I know I've taken iodine deficiency out of the equation in my diet because I add a lot of salt to my food. So I don't measure iodine levels. I don't care if they're high or low. Take them out of the darn equation by putting yourself on iodine as a condiment to your food together with your salt, which you have to take not have to, should be taking every day, in my opinion. Then we look at the T3, T4, total and free, and the TSH. How many doctors don't just order a TSH and treat someone based on TSH? That's ridiculous. And the most important numbers are the thyroid peroxidase and thyroglobulin antibodies, because they do not only diagnose, they also help me to understand the progression of Hashimoto's disease, which is an autoimmune disease related to grain consumption and carbohydrate consumption. That is the commonest autoimmune thyroid disease that we have in America.